At 6:15 in the morning, Mr. Ernest woke up with a strange sensation in his left arm. It wasn't a sharp pain. It wasn't anything that would make him scream or panic. Just a slight numbness, as if he'd slept in a bad position. He thought it would pass in a few minutes, that it was only a matter of moving a little and stretching. But that morning, the coffee tasted different. The toast slipped from his hands. And by 9:30, he was already in the emergency room. The diagnosis was clear. He had had a minor heart attack during the night. Stories like Mr. Ernest's happen every day. What began as a mild symptom, the kind we usually ignore, ended up being the first sign of something serious. And that's the problem. We wake up with discomfort, aches, confusion, sweat, or exhaustion, and we blame the mattress, the weather, the years. Sometimes it's true, but other times, it's the body shouting in a low voice. The body speaks, but only if we learn to listen. That's why today I want to tell you about 8 common symptoms upon waking that many older adults normalize, and that could be warning of important health issues. This isn't about scaring you. It's about helping you stay alert, about giving you tools, about showing you that even the smallest thing can have great importance if you know where to look. So if, on waking, you felt something out of the ordinary lately, stay with me. Maybe today you'll discover something that could make the difference between preventing and regretting. And before we go on, tell me in the comments, how old are you and where are you watching this video from? I'll love to read you. Mental confusion on waking. Just tiredness or something more serious? Has it ever happened that you wake up and you don't know if it's Monday or Sunday? That for a moment you don't recognize where you are, or you struggle to remember what you had to do that day? Maybe you tell yourself it's because you slept little, or because you went to bed very late the night before. And yes, sometimes tiredness is enough to cloud the mind. But what happens when that occurs every morning? What happens when the mental fog doesn't lift after drinking coffee? And what if, in reality, it isn't just tiredness? In old age, waking up confused can seem normal. People downplay it. They say, my mind just isn't as quick, or it must be my age. But there are times when that confusion is a warning. Mrs. Martha, for example, had this often. She is 78 years old and had always been very organized, but she began waking up not knowing what day it was. Sometimes she confused the kitchen with the bathroom, or called her granddaughter by her daughter's name. She thought it was stress, that she was staying up late watching television. Until her doctor spoke plainly. This was not normal. After several tests, they discovered she had had small strokes during the night. Silent, without classic symptoms. Just that morning confusion that seemed harmless. What many don't know is that confusion on waking can be an early symptom of serious conditions such as mini-strokes in the brain, onset of cognitive decline or dementia, episodes of hypoxia from sleep apnea, blood sugar drops in people with diabetes, side effects of poorly adjusted medications. These conditions, if detected in time, can be treated or slowed. But if ignored, they can advance silently. So when should you worry? If upon waking, you frequently struggle to orient yourself in time or space. You constantly forget basic names or words. You confuse objects or people. It takes you more than 30 minutes to feel clear-headed. You have episodes of disorientation accompanied by headache, blurry vision, or weakness. It's time to talk to your doctor. There's no need to panic. Not every lapse is a serious sign, but what is important is to observe patterns. Does it happen every day? How often? Is it getting worse? Keep a small notebook by the bed and write down what you remember each morning. Do it for a week, and if you see something that worries you, share it with a professional. The mind, like the body, needs attention, and the first minutes of the day can reveal more than we imagine. Ignoring those moments is like closing your eyes when the traffic light turns red. Sometimes it's just a warning, but other times it's the only chance you have to react in time. Severe headache the moment you open your eyes. Waking up with a headache is not the same as going to sleep with one. When you open your eyes and the first thing you feel is pressure, heaviness, throbbing, or stabbing pain, your body is sending you a message you shouldn't ignore. Many older adults have gotten used to living with pain. They normalize it. They say, It's the weather, it's the mattress, or it's my age. And yes, there are days when the body simply complains about what you ate or how you slept. But if a headache greets you every morning like an alarm, there may be something more behind it. There's a big difference between a common headache and one that appears repeatedly on waking. Common headaches are often related to the previous day's tension, stress, eye strain, or poor posture. They tend to show up later as the day goes on, but the morning headache can be an early sign of undiagnosed nighttime high blood pressure, sleep apnea when oxygen drops during the night, chronic dehydration, very common in older people who drink little water, neurological problems such as increased intracranial pressure, side effects of medications, especially if taken before bedtime. A close case is Mr. Richard, 76 years old. For months he woke up with intense pain in his forehead. He thought it was migraine because it passed as soon as he had breakfast. But one day, the pain was so strong he felt nauseated and had to lie down again. His doctor ordered a sleep study. The result? He was stopping breathing more than 30 times per hour during the night. His brain was fighting for oxygen, and the headache was its way of protesting. There are signs that can help you tell whether that morning pain deserves more attention. If it's stabbing, constant, and doesn't improve after breakfast or drinking water. If it's accompanied by blurry vision, ringing in the ears, or dizziness. If you wake up several times a week with the same discomfort. If you feel pressure in the nape or behind the eyes. If the pain keeps you from starting the day clearly. In these cases, the best thing is to talk to a doctor. Simple tests can rule out serious causes. An adjustment to medications, a change in sleeping posture, or using a breathing device can make a big difference. And remember this, your body is speaking even while you sleep. Pain is not your enemy, it's your ally. It's the silent guardian that, if you listen in time, can help you prevent something much more serious. Don't get used to waking up with pain. Don't make it part of your routine. Always ask yourself, why is it there? What is it trying to tell me? Because in old age, every day is valuable, and waking without pain is possible too. Numbness or weakness on one side of the body. You wake up in the morning, open your eyes, and when you try to sit up, you notice something isn't right. Your left arm feels as if it isn't yours. Your right leg responds slowly, as if it weighed twice as much. You try to move your fingers, but there's clumsiness, stiffness, numbness. Your first thought is, I slept in a bad position. And many times, yes. A bad posture can compress a nerve or make a limb fall asleep. But that sensation fades in minutes. What's worrisome is when it doesn't go away, or when it happens for no apparent reason, again and again. Unilateral numbness or weakness on waking can be an early symptom of a stroke, even if there's no pain or total paralysis. Many older people ignore this sign. They blame the mattress, the cold, or just being old. But the truth is, the body never goes numb without a reason, and much less so on only one side of the body. And how does it really feel? Imagine trying to lift a cup with your usual hand, but suddenly you have no strength. Or you stand at the edge of the bed, and your right leg trembles uncontrollably. It feels as if your body had divided in two. One side is with you, the other won't respond. That imbalance, that lack of control, that sudden clumsiness is a red flag. Especially if it appears suddenly, without having done physical effort the day before. It affects only one side of the body, arm, leg, or face. It comes with difficulty speaking or changes in vision. It lasts more than 10 or 15 minutes without improvement. You feel you can't hold objects or walk as usual. When these symptoms occur, there's no time to lose. If you or someone you know wakes up like this, call emergency services immediately. Don't wait to see if it gets better. Don't take a pill and go back to bed. In a stroke, every minute counts. There's a rule that can save lives. It's called FASTF for face. Ask the person to smile. Is one side drooping? A for arms. Ask them to raise both arms. Does one drift down or not move? S for speech. Ask them to say a simple sentence. Are the words slurred or can't they speak? T for time. If there's any sign, call your country's emergency number at once. Mini strokes are more common than we think, and they're often silent. but the body announces them in its own way. And many times it does so on waking, because that's when circulation changes abruptly and the brain reactivates. Waiting can make the difference between a full recovery or a permanent disability. So don't let it pass. Listen to your body. Not every morning is the same, and when one of them begins with a part of you not responding, it's because something serious may be happening inside. Blurry or double vision the moment you open your eyes. You wake up and see the world in a blur. The lamp looks out of focus. You can see the window, but not quite clearly. You try blinking a couple of times. You rub your eyes, but the image stays blurry, as if you were still trapped between sleep and wakefulness. Many attribute it to slow waking, nighttime dryness, or the passage of years. And it's true, vision changes with age. After 60, it's normal to lose some sharpness, need more light, or use reading glasses. But there's a difference between that and waking daily with double, blurry, or distorted vision. That difference may look small, but in reality, it can be the line between healthy sight and a disease in progress. Mr. Albert, for example, is 73 years old. One morning he woke up seeing things with a strange haze, as if someone had fogged his glasses. He thought he was dehydrated, drank water, and didn't give it much importance. But the next day it happened again, and the next as well. When he finally went to the eye doctor, he was diagnosed with open-angle glaucoma. He had begun losing peripheral vision without noticing, and if he had waited a few more months, the damage would have been irreversible. Vision problems on waking can be related to several important causes. Glaucoma, a silent disease that damages the optic nerve due to increased eye pressure. Poorly controlled diabetes, which affects the retina's blood vessels and causes distorted vision. Neurological problems, such as mini-strokes or lesions that interfere with communication between the brain and the eyes. Nighttime dehydration, which reduces tear production and dries the cornea. Elevated blood pressure during the night, which affects blood flow to the eyes. So, when should you worry? When blurry vision happens several times a week on waking. If it takes more than 15 minutes for the image to clear. If you see lights, flashes, floaters, or wavy lines. If you feel pain behind the eyes or a strange pressure. If you experience double vision or sudden focus changes. In any of these cases, it's important not to wait or self-medicate. Many people use over-the-counter drops thinking it's dryness, when in reality they may be masking a serious condition. After 60, it's essential to have at least one eye exam per year, even if you have no discomfort. Because many eye diseases are progressive yet silent. They don't hurt, they don't alarm, they just steal your sight little by little, until one day you notice you no longer see as before. And vision can't always be recovered once it's damaged. The good news is that if detected in time, many of these conditions can be treated, halted, or controlled. Seeing well is not a luxury. It's quality of life, independence, safety. And upon waking, your eyes can tell you much more than whether the sun is up. They may be warning you that something isn't right, and you still have time to act. Extreme fatigue or a heavy body on getting up. You wake up. You've slept 8 hours. The room is quiet, but your body weighs like a rock. You feel yourself dragging out of bed. Every step is like walking with a wet blanket over you. And you think, I must have slept badly. But no, it's not that. You slept well. You didn't stay up late. You didn't have insomnia. So, why are you exhausted the moment the day begins? This happened to Mrs. Teresa, a 74-year-old woman, active and careful with her health. She went to sleep at 10 at night and woke up at 6, like clockwork. But every morning when she tried to get up, her body wouldn't respond. It wasn't pain. It wasn't sleepiness. It was an inexplicable tiredness, as if she hadn't rested at all. After weeks like this, she decided to get checked. The diagnosis was a surprise: sleep apnea and early heart failure. While she slept, her heart was working twice as hard without her knowing it. Her body wasn't really resting. It was surviving. This isn't rare. In many older adults, extreme morning fatigue has less to do with the number of hours slept and more to do with the quality of rest and with what's happening inside the body during the night. The most common causes of this unexplained fatigue include sleep apnea, when you stop breathing at times and the body wakes up without you noticing. Mild heart failure, the heart doesn't pump blood efficiently during the night. Hormonal problems like hypothyroidism, which slow the whole metabolism. Uncontrolled diabetes, which alters glucose and energy levels. Depression or mood disorders, which drain you emotionally and physically even if you sleep. And how do you tell common fatigue from clinical fatigue? Pay attention to these signs. If exhaustion doesn't improve even after sleeping well for several days in a row. If you feel muscle heaviness or difficulty concentrating in the morning. If you wake with palpitations, shortness of breath, or sweating. If the tiredness gets worse doing simple tasks like bathing or getting dressed. If you have a lead body sensation, especially in legs and arms. When this becomes habitual, it's time to act. What can you do? First, keep a small daily log of your rest. How many hours did you sleep? Did you wake up during the night? How did you feel when you opened your eyes? Did you have energy during the day? That notebook can be a valuable tool for your doctor. It will help detect patterns and look for hidden causes. Second, care for your sleep routine. Light dinner, dark environment, no screens before bed. Third, ask whether a sleep study is necessary, especially if you snore loudly or if your partner notices pauses in your nighttime breathing. And above all, don't normalize chronic tiredness. Being old does not mean being tired all the time. Waking with energy shouldn't be the exception, but your norm. Your body doesn't just need rest, it needs you to listen, to pay attention, and to act when it's telling you something isn't right. Don't ignore that heaviness. It could be the first clue that something deeper is going on. It's 5:40 in the morning. You wake with a start. Your pajamas are soaked, the sheets damp, and your heart is pounding as if you'd run a marathon. You don't know whether you were dreaming, whether it was a nightmare, or whether your body simply decided to go on alert while you slept. You sit up in bed and breathe deeply. There's no pain, no fever, no apparent reason. Just a cold sweat and palpitations that take minutes to calm down. These episodes aren't uncommon, but when they repeat frequently, they're a sign that something inside isn't working well. Mr. Samuel, 79 years old, had this often. He woke with his chest racing, his forehead damp, and a sense of anguish he couldn't explain. He blamed nightmares, but the truth is, he didn't remember any bad dream. Only his body, shaking him out of rest every dawn. After a cardiology consult and a series of tests, they discovered that Mr. Samuel had nighttime tachycardias. His heart was shifting into accelerated rhythms while he slept. It was his autonomic nervous system, out of balance, and also his thyroid working in overdrive. Excessive sweating upon waking, especially if accompanied by palpitations, can have several serious causes. Nighttime hypoglycemia, when blood sugar drops too low during sleep, especially in people with diabetes or metabolic problems. Overactive thyroid, hyperthyroidism. The thyroid produces too many hormones and speeds the whole body, even at rest. Mild cardiac episodes, such as arrhythmias or paroxysmal tachycardias that only occur at night. Nighttime anxiety or autonomic nervous system disorders, more common in old age than people think. Hidden infections or inflammatory processes that raise body temperature without an apparent fever. Now then, how do you tell normal body sweat from the kind that deserves attention? Pay attention if you wake up soaked with no external cause, no fever, no excess blankets, no environmental heat. Your heart is racing, even if you aren't scared. You feel tremors, weakness, or dizziness on getting up. This happens more than 2 times per week. It's hard to fall back asleep after each episode. In these cases, drying off and going back to bed isn't enough. Your body is activating its emergency system, and that's reason enough to act. What can you do? 1. Keep a nighttime log. Keep a notebook on your nightstand and write approximate time you woke up, whether you felt sweat, chills, heat, palpitations, or confusion. How long the episode lasted, what you ate the night before, whether you took medications before bed. 2. See your doctor and show that log. Not all tests are done during the day. Some episodes require nighttime monitoring with special devices to detect arrhythmias or glucose swings while you sleep. 3. Review your evening diet. Avoid very heavy dinners, alcohol, or sweets before bed. And if you're diabetic or take blood pressure medicine, never go to bed with your stomach completely empty. And finally, don't assume it's just stress or a bad dream. When the body wakes you, it's because something's wrong while you're disconnected. Excessive sweating and palpitations are visible signs of a system working harder than it should while you rest. And if they repeat, don't ignore them. The heart doesn't shout, but it beats hard when it wants you to listen. You open your eyes, but instead of starting the day with a quiet sigh, you gasp. Your chest feels tight, as if something heavy had settled on you during the night. You sit up slowly, searching for air, trying to fill your lungs. And the air doesn't seem enough. This kind of episode can last seconds or minutes, but the impact is deep. Anxiety, fear, confusion. Some people describe it as waking up choking on nothing. Others, as if they had been holding their breath without knowing it. And it's important to say it clearly. Waking up with shortness of breath is not normal, and it should never be ignored. This was the case with Martha, a 75-year-old woman, non-smoker, without serious history. For months, she woke up feeling short of breath, especially when she slept on her back. She blamed her age, the weather, her posture, until one day she couldn't catch her breath and ended up in the emergency room. After several studies, the diagnosis was clear: mild emphysema, a progressive disease that had begun silently. This symptom can be linked to several serious health problems. Obstructive sleep apnea. During the night, the airway collapses for seconds or minutes, causing pauses in breathing. Many times the person wakes without knowing why. Heart failure. The heart can't pump blood efficiently, leading to fluid buildup in the lungs, making breathing lying down difficult. Chronic lung diseases like COPD, bronchitis, or emphysema, even in people who never smoked. Severe gastroesophageal reflux. It can cause microaspirations at night that irritate the airways. Nighttime anxiety or panic attacks, less common but possible in older adults. How do you recognize if this symptom is serious? Take note if you wake up gasping or feeling like you're suffocating, even without a dream. You feel intense chest pressure that improves only when you sit or stand. You have a dry cough or thick phlegm on waking, especially if it repeats. You notice wheezing or noises in your breathing, even without a cold. It takes you more than 5 minutes to breathe normally again. These are signs that your lungs, your heart, or both need attention. What should you do if this happens? 1. Don't stay lying down. If you feel short of breath, sit up immediately. Breathe in through your nose and exhale slowly through your mouth. 2. Note the episode: time, duration, intensity, sleeping position. 3. If it happens more than 2 times per week, or if it gets worse, consult a pulmonologist or cardiologist without delay. 4. Request a sleep evaluation. Many nighttime breathing problems aren't detected in a routine exam. If you use multiple pillows or need to elevate your head to sleep better, that's also a sign. Sleeping half-seated shouldn't be a necessity, but an alert. Breathing is something we take for granted, until it stops being easy. And when your body wakes you because it's short on air, it's shouting that something isn't working as it should. Don't cover it with excuses. Don't get used to the gasping. Waking without breath is not a normal part of aging. It's a warning, and it can be the first chance to prevent something much more serious: joint stiffness or sharp neck and back pain on waking. It's 7 in the morning. Your body tells you it's time to get up, but your joints disagree. You try to turn your neck and feel a pull. You sit on the edge of the bed, but your lower back hurts, as if you'd carried sacks of cement all night. You bend your fingers. They stretch with difficulty. You stand up slowly, feeling that every movement costs more than the last. We call it morning stiffness. And for many older adults, it's part of the daily wake-up. But here's an important truth. You shouldn't start the day in pain. And if every morning feels like a battle to move normally, it's time to look beyond age. This stiffness, especially if focused in the neck, back, and large joints like hips or knees, can be a sign that something deeper is going on. Mr. Richard, for example, is 72 years old. For almost a year, he thought his stiffness was normal for his age. He woke with his hands like clenched claws, his back tight as a board. But after a full workup, they discovered he had late-onset rheumatoid arthritis, an autoimmune disease that had been affecting his joints from within, silently. And morning stiffness that lasts can be caused by rheumatoid arthritis, a disease in which the immune system attacks the joints, causing inflammation, pain, and prolonged stiffness, especially at the start of the day. Osteoarthritis, wear of the joint cartilage, creating bone-on-bone friction and pain, especially after several hours of inactivity. Systemic inflammation, where the body generates a generalized inflammatory response, affecting muscles, ligaments, and joints. Ankylosing spondylitis, which mainly affects the spine and causes intense stiffness in the lower back and neck. Fibromyalgia, a complex syndrome that can cause stiffness and pain on waking, even without visible joint damage. Now, when should this stiffness worry you? If it lasts more than 30 minutes every morning, if it keeps you from your normal activities without prolonged stretching, if there's swelling or redness in the joints on waking, if pain improves when you move but worsens if you stop, if it's accompanied by fatigue, low-grade fever, or unexplained weight loss. What can you do if this happens to you? 1. Don't normalize it. Feeling stiff for a few minutes can happen now and then, but if it's daily and limits your mobility, it deserves medical attention. 2. Incorporate gentle movements on waking. Slow stretches, rolling shoulders, moving wrists and ankles before getting out of bed. These small actions activate circulation and help reduce stiffness. 3. Stay active during the day, even with adapted exercises. Movement is medicine for joints. 4. Pay attention to your mattress and sleeping posture. Sleeping with your neck twisted or without good back support can worsen symptoms. 5. See a rheumatologist if symptoms persist for more than 2 weeks. This specialist can perform specific tests to detect inflammatory or autoimmune diseases. And of course, don't self-medicate with painkillers every morning. Temporary relief doesn't solve the cause, and many medications taken in excess can harm your stomach, liver, or kidneys. Your body has a voice, and that voice is pain. And when every morning begins with stiffness or discomfort, it isn't speaking out of habit, it's asking for attention. Listen to your joints, listen to your back, because every day can be lighter if you learn to care for the foundations that hold you up. Over these minutes, we've gone through 8 morning symptoms that may seem small, but could be telling you something very important. 1. Mental confusion on waking, when you don't recognize the day or struggle to orient yourself. 2. A severe headache on opening your eyes, which may be speaking of high blood pressure or neurological problems. 3. Numbness or weakness on one side of the body, which isn't always just a bad sleeping position. 4. Waking with a sense of choking, which could signal apnea, heart failure, or lung problems. 5. Extreme fatigue despite having slept well, sometimes related to the heart or the thyroid. 6. Excessive sweating or sudden palpitations, which can be hypoglycemia or hidden arrhythmias. 7. Intense joint stiffness, often linked to arthritis or systemic inflammation. And 8. Neck or back pains that repeat at dawn, a sign that your joints need attention. Perhaps you felt one of these symptoms, or several, and maybe you thought, like many, that it's part of aging. But let me tell you something. Growing old is not synonymous with suffering. Your body has the right to rest and wake in calm, and you have the right to live with energy, dignity, and clarity. There's a phrase I like very much, and I want you to remember. Your body whispers before it screams. Don't wait for the scream. It's in those whispers, in that unusual tiredness, in that recurring pain, in that ragged breath, where the chance to prevent something more serious begins. That's why my final recommendation is simple but powerful. Keep a small daily log. You don't need to be a doctor, nor write whole pages. Just note how you felt on waking each day. Did you sleep well? Did you feel pain, sweat, confusion, tiredness. Those lines could help your doctor save your health, or even your life. And now, I want to hear from you. Have any of these symptoms happened to you? Do you identify with any of these stories? Tell me in the comments. Your experience can help others. And if you know someone over 60, share this video with that person. It can make a big difference. It can even save their life. Thank you for staying with me this far. Remember, every morning is a new chance to listen to your body, to care for yourself, to act. See you in the next video. Until then, wake with awareness and live with intention.